Hit Exchange Media Coverage, HIMSS 11.
Well, I think the real key issue in everyone's mind is how they're going to get to meaningful use. If they're a vendor, how can they support their providers? If they're a provider, how can they get their technology there? And no matter what kind of provider they are, what do they have to do to even get beyond the technology? So I do think that's really the driver. Everyone understands there's a lot of opportunity and everyone needs to be able to cash in on it. The biggest challenge, particularly on the hospital side, is really understanding what they need to do to get certified. There is a challenge also in terms of actually doing the meaningful use process. But so many of the hospitals in the country either have self-developed systems, have systems that are certified but are not in full use, and they have their own complementary customizations. Or thirdly, they may have systems that haven't been upgraded to certification yet. So we've developed a program based on the fact that we knew this was coming a year ago. And a year ago we announced that we would be developing a program to support hospitals. It's functional, it's live. We're happy to share the fact that we're working with a lot of organizations. We have over 1,000 hospitals signed on, and I think they are well on their way to meeting that first step.
We were talking just a little bit ago about the concerns that a couple of CIOs have raised about the need to purchase particular EHR modules to achieve meaningful use that they don't intend on actually utilizing. Can you speak to that a bit in your perspective?
I will, and it isn't so much an EHR module, but I think that ONC has been very clear that if their vendor has a complete EHR certified solution, then they must have purchased the entire EHR in order to demonstrate that they have certified technology. That doesn't mean that they have to use every module, but they at least have to have it within their bailiwick. There are many hospitals who have purchased something, but they still have their own systems that they may have built. And frankly, the easy solution to that is just to contact us. We can do a certification for them of whatever self-built technology or customization they have to complement their full EHR. And then, what they pay for the full EHR is obviously a negotiation between the hospital and the vendor.
By actually certifying for stage 1 and going through that process, it actually starts the clock for committing to stage 2. And so there's some hesitancy that we're picking up on CIOs and organizations that don't necessarily want to go through that certification process and actually accept any funds yet, since stage 2 still hasn't been finalized and it kind of starts the clock. What advice would you give along those lines?
Well, I do think that every single institution has to do their own business analysis with respect to what is for them and what strategies work for them. And very clearly there are going to be some institutions who would choose to wait and get a stage 2 certified product. Recognizing that there may be loss of funds for a year or two, but the cost of getting to where they need to be 3 years from now don't justify what they would get in terms of the return. So that's a very intensive analysis that every institution has to make, the CIO, the CFO, and the CEO together to make that decision.
Some folks have said that the stage 2 criteria as it exists today is too vague and not specific enough. What is your take on that?
Well, the stage 2 criteria, as you know, are still in the proposal phase. And ONC has asked for a lot of public comment, which ends, I might add, this Friday, about how to make that more specific and what particular stage 2 criteria might be necessary to get to what's been proposed in stage 3. So I do think that some of the criteria have been relatively less specific than others, but it's very clearly with the intent that ONC is looking for input from both the vendor and the provider community. CDS is a good example for that.
There's also been concern about the ramp up of CPOE from 30% to 60%. Do you see that as being an issue that many hospitals will in actually implementing, getting to that?
What we have been hearing from our own constituency is that if the process is already in place and the technology is already there to support it, then they do not believe it will be out of the question to be able to ramp up and go from one particular level to another. I think the big concern is for some of the newer measures and objectives that have been been proposed, and from where the technology is going to require a major bump up. I think that's the bigger issue.
And similarly, the uptick from e-prescribing from 40% to 50%, is that likely going to be an issue as well, or?
We've not been hearing that it is. Most institutions have been telling us that they can do this. Catch the premiere issue of HIT Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.